But I guess give me some insights into how you feel the function of locums, like the utilization within our hospitals or clinics, has changed from the beginning, 40-ish years ago, right, to now.
Ladies first, perhaps?
All right. I mean, I think we joke around and we say this, that we used to be considered the necessary evil. And that's me being generous, because I wasn't always quite that nice. And today, we're really, truly a strategic partner. You know, we're part of most facilities' strategic staffing plan on how they're going to ensure that they can take care of all of their patients. And that's a huge shift, you know, for us, and a welcome one. You know, obviously, you know, we want to partner as best we can. We want to ensure that the staffing levels are where they need to be for quality care to be provided. But it's a big change from where we started so many years ago to where we are now.
What would you say are some of the things that moved it from that transactional relationship into that partnership? I know we talked about that before. Yeah. Go ahead.
I mean, I'd like to say it's the skill and expertise of all the locums companies, but I think in reality, a lot of it's a necessity. You know, trying to solve for the physician shortage kind of in the traditional way that we've done it before. You know, really we've reached a point, and you can see from this slide that the shortage is so dramatic that I think our you know, healthcare organizations that we work with are really you know, in a position where they have to get creative in how they think about staffing. On the flip side of that equation, I think the kind of the outlook on temporary staffing from the clinician side has also changed, and I think the way that clinicians think about work has changed dramatically. I think that may be one of the silver linings from the pandemic, is it kind of accelerated that mindset and thought process, and you know, really kind of opened some minds to kind of looking at alternative you know, ways of working that plays very nicely into what we do and how we support our clients.
Yeah, absolutely. Anything, Leslie?
I think, you know, as you think about what's going on in the country at large and the aging of our population and the consumption of medical care and what we're going to require both now and in the future, that part of that strategic shift has to do with, you know, a health system needs to be creative and use all possible venues to close a gap like that. Whether it be locums, whether it be use of advanced practice professionals on a perm or a locums basis, telehealth, other preventative, you know, triage work to make sure the patient's to the right spot. I mean, all of those things, the problem is big enough that it takes the combined unit of things, of which locum tenens agency partnerships have to be pressed on, and all of us have to step in to do the best we can, because the country needs our help, as well as our physicians that we represent need our help to make sure they're not inadvertently leaving profession or making choices that make the problem worse. And so there's a creativity in all venues needed, and I think that's been one of the bigger shifts in at least the decade that I've been a part of it.
Yeah, and I would say the data that was presented this morning, just the aging population data, along with, oh, by the way, those are also our physicians. So 2.5 active physicians today will be 65 plus within the next decade. So my real job is to recruit perm people, not locums. I do this on the side for fun. But, you know, there's a potential for those accelerated retirements. I think we're all seeing that from, you know, the burnout or whatever it is. You know, maybe they got sick themselves. So that's really staggering. I think the other thing that I saw is really, you know, we're at like this huge pace where, so they're over 60, 65, but the population that's aging over 75, it's about 75%, right, of that number of that aged population. So that just leads to the significant need of specialists. And, you know, you think of all of those healthcare providers who have to touch those folks as we age. So,